Hi, this is the video part 2 on doulas. As I was saying, you really can't afford not to hire a doula. In this day and age, if you think about it, if you really give it some thought and you consider the truth about having a birth in a hospital setting, even a birth center, the doctor that you're with most likely won't be able to be with you through the whole birth. And in some cases won't be there until the very end when the baby is actually crowning and coming out, which means that you're going to have to rely on whatever nurse you get, and you don't know who you're going to get until you get there. So, say you're somebody that is pretty sure you don't want to have an epidural, but you're not really certain about it. Well, if you hire a doula, your doula will go over the risks as well as the benefits and talk to you throughout your pregnancy so that you really get a firm idea, a good idea of what you want and make firm decisions before you get to the hospital. A lot of women have a wait and see attitude about their birth, which is really not a good idea. And the reason it's not a good idea is because when you're in labor, you're busy, you're thinking, your body is in a process trying to get the baby to come out, and so you're really concentrating on that. If you don't have any decisions made ahead of time or have thought about anything to do with your birth, it's really quite possible that you can end up doing things that you don't really want to do, and later you're going to regret them. Now, I'm not saying that you necessarily will do that, but there's a good possibility that that's exactly what's going to happen. So, if you hire a doula, you'll be able to discuss this with her, and it will be very, very helpful to you. Believe me, it's a really good idea. Like I was saying, you will have to rely on whoever you get when you get to the hospital, and say you're somebody that, wants to try to do a natural birth. Not all nurses are for that. Some are, and some will be a great help to you. For example, whenever I had my first baby, I wanted to have a natural birth. Well, my first nurse wasn't very supportive. She wasn't mean, and she wasn't unhelpful. She just wasn't there. She was in and out of the room. She would just check my blood pressure. She would put the monitor on me and listen or watch the contractions. And, she just kind of, didn't help a whole lot. But toward the end of labor, there was another nurse that came on duty, and she was extremely helpful. I was very thankful. But that was the luck of the draw. I didn't know who I was going to get. I was very fortunate to get somebody that was there to help me through the contractions. So another reason you want to hire a doula is because she'll help you through contractions. I know that sounds kind of like, yeah, whatever, but you would be surprised. Just having someone there to hold your hand or help your husband know how to best help you, and just to talk to you and cheer you on, or just to be quiet and sit there and be supportive of you, is so amazingly helpful. I know my own husband, whenever he would try to help me through a contraction, if he would touch me, I would throw up, unfortunately for him. So all the hours of prenatal classes that we had taken really did not help when push came to shove and I was in labor. That was my first birth, and I did not have a doula. For my third, I did have a doula. And I remember he felt like he was so much more involved because the doula was able to make suggestions on how he could best help me. And I know that at one point she said, if you stroke her hair, she won't throw up. So that's what he did. He stroked my hair, and she suggested at one point to get on his hands and knees so I could lean on him. And I did, and that helped as well. And in all, I think it was helpful for him to have somebody to kind of look at. If he felt like things were getting scary or he was worried, he could look at the doula and say, what's going on? And she could calm him down and say, this is actually absolutely normal. Just hang on. All right, I'm going to go to the next video, part 3.